Good morning, all of you. So today we are going to discuss the topic of Decryocystitis. So I'll be discussing the acute Decryocystitis today, right? So this is also an important topic for your practical examination. So it can come as a short case to you all. So the contents which we'll be looking at will be definition, etiology, predisposing factors, causative organisms, clinical picture, complications, and finally the treatment. Okay, so I'll start off with the definition of Decryocystitis. So Decryocystitis is an infection of the lacrimal sac secondary to the obstruction of nasolacrimal duct at the junction of the lacrimal sac. So this is the main definition of Decryocystitis. So acute Decryocystitis again is an acute suppurative inflammation of the lacrimal sac characterized by the presence of painful swelling in the region of the sac. So you need to remember that in acute Decryocystitis you will have pain, so it will be a painful condition, so it will be a painful swelling in the region of the lacrimal sac, right? So this is an acute suppurative inflammation of the lacrimal sac. So this is the exact definition of acute Decryocystitis. Now we come to the etiology. So it may develop in two ways. First is as an acute exacerbation of chronic Decryocystitis. Okay, so this is usually, it gets infected mainly from the neighboring structures like paranasal sinuses surrounding bones and dental abscesses mainly in the upper jaw. So these are the involvement from the neighboring infected structures. So this is the etiology behind acute Decryocystitis. Predisposing factors is usually, first we have the age. So the age, it is more common between 40 to 60 years. Then we have mainly, it is seen in females due to comparatively narrow lumen of the bony canal. So this is the reason. Then we have the hereditary, which plays an indirect role as it affects the facial configuration and also the length and the width of the bony canal. And last we have the poor personal hygiene. So this also is an important factor which leads to Decryocystitis, right? So these are the predisposing factors which is usually involved in acute Decryocystitis. Then we have the organisms. So the mainly organism involved is Streptococcus, Pneumococcus, and Staphylococcus. So it is most commonly caused by Staphylococcus aureus and Streptococcus pneumoniae. So the most common complication usually, you get is corneal ulceration. So it is frequently associated with Streptococcus. Okay. So again, I'll just take a recap. Decryocystitis is an infection of the lacrimal sac secondary to the obstruction of the nasolacrimal duct, where at the junction of the lacrimal sac. So this you need to know, and the organisms you need to know. You need to know the ways from the neighboring structure how it causes, right? Now we come to the clinical picture. It can be divided into three stages. So first we have is the stage of cellulitis. Then we have is the stage of lacrimal abscess. Then we have a stage of fistula formation. So these are the three important stages in which the acute Decryocystitis usually, occurs. Okay, so first we'll discuss about the stage of cellulitis. So it is characterized by painful swelling in the region of the lacrimal sac. Swelling is generally red, hot, firm, and tender. Redness and edema also present, also spread to the lids and the cheeks. So there's epiphora, and again you will get the symptoms such as fever, malaise, and when treated, resolution may occur at this stage. If untreated, self-resolution is rare. So this needs treatment, this you need to know. So this is the stage of cellulitis. So anyways, you're going to have swelling, you're going to have pain, redness, tenderness, right? Edema, epiphora, sometimes fever also. So these are the symptoms of stage of cellulitis. Then we have is the stage of lacrimal abscess. Okay, so this is a stage of lacrimal abscess. So continued inflammation causes occlusion of the canaliculi due to edema. So the sac is filled with pus, distends, and its anterior wall ruptures, forming a pericystic swelling. So in this way, a large fluctuant swelling, the lacrimal abscess, is formed. So it usually points below and to the outer side of the sac due to gravitation of pus and the presence of the medial palpebral ligament in the upper part. Okay, so this is the second stage, which is the stage of lacrimal abscess. So this, you can say, is a picture of the lacrimal abscess. So the patient is having a lacrimal abscess, right? Okay, now we have is a stage of fistula formation. So when the lacrimal abscess is left untreated, it discharges spontaneously, leaving an external fistula below the medial palpebral ligament. So rarely the abscess may open up into the nasal cavity, forming an internal fistula. So this you need to know is, first we have is the stage of cellulitis, which is followed by the stage of lacrimal abscess, and finally when the lacrimal abscess left untreated, and then it leads to the fistula formation. So this can be external fistula formation, and it can be internal fistula formation. Okay, so this is an external fistula formation, which you can see in the picture. Okay, right? So again, if you come to the signs and symptoms, so there will be pain, swelling, redness over the lacrimal sac at medial canthus. There will be epiphora, crusting, fever. Digital pressure over the lacrimal sac may extrude pus through the punctum. So in chronic cases, tearing may be the only symptom, right? So this you need to know, and anyways you know the etiology, you know the definition, right? So next is I wanted to discuss about the pathophysiology. So the variety of causes may lead to Decryocystitis. Most often, obstruction of the nasolacrimal duct leads to the status of the nasolacrimal fluid, so which predisposes to the infection. So anyways, as you all know, the Staphylococcus aureus is a common bacterial pathogen causing infectious Decryocystitis. So sometimes, especially in women, stones may develop in the lacrimal glands, so causing the Decryocystitis. So this condition is called an acute Decrocystic retention syndrome. So this usually occurs in women. So this is again an important thing. In complications, if we come to the complications, we have acute conjunctivitis, we have corneal abrasion, which may be converted to corneal ulceration. Then we have is the lid abscess. Then we have is the osteomyelitis of lacrimal bone. We have orbital cellulitis. We have facial cellulitis. We have acute thymoiditis, and rarely cavernous sinus thrombosis, and very rarely septicemia may also develop. So these are the complications of acute Decryocystitis. Okay. Now if we come to the treatment part, so during the cellulitis stage we give a systemic antibiotics, so which is generally ciprofloxacin or cephalosporin or tetracycline or cotrimoxazole for 7 days, and topical antibiotics to control the infections. Topical antibiotics, you can give any kind of antibiotic like gadifloxacin or moxifloxacin. Systemic anti-inflammatory analgesic drugs and hot fermentation to relieve pain and swelling. So to control the pain and swelling, we usually give systemic anti-inflammatory analgesic drugs and hot water fermentation. Okay. Now during the stage of lacrimal abscess, right, in addition to the above treatment, so when the pus starts pointing on the skin, it should be drained with a small incision. So this process is usually called IND, which is incision and drainage. This is usually done done in the OT. So the pus should be gently squeezed out, and the dressing should be done with betadine. Later, depending upon the condition of the lacrimal sac, either DCT or DCR operation should be carried out. So once it is cured, then we think of DCT or DCR. So while thinking of DCT and DCR, we usually see the patient's age. So if the age is usually the patient is elder, so we usually do DCT, and in young patients we usually prefer DCR. So this should be carried out, otherwise recurrence would occur. So that's why once this subsides, we usually go for the procedures of DCT or DCR. Now during external lacrimal fistula, so after controlling the acute infection with systemic antibiotics, fistulectomy along with DCT or DCR operation should be performed, right? So this is again done after the control of acute infection with systemic antibiotics. So systemic antibiotics play a very important role nowadays. We usually give augmentin for acute infections. So that in the studies we have seen ki augmentin have very good results in treating Decryocystitis. Okay, so this is again, I'll take a short recap about acute Decryocystitis. This is an important topic for your practical examination. So I think this time this case would be there of acute Decryocystitis, right? So only thing you need to know in Decryocystitis is again an infection of the lacrimal sac secondary to the obstruction of the nasolacrimal duct, and at which position? So the position is the junction of the lacrimal sac. So it is and most commonly caused by Staphylococcus and Streptococcus, and the most common complication where usually the examiner asks what is the most common complication of acute Decryocystitis. So the most common complication is corneal ulceration, and that too is associated with Staphylococcus, right? So, and the mainstay of the treatment are oral antibiotics, warm compresses, right? And when these are treated, then we think of DCR or DCT. So again, there are many factors to think about DCR or DCT, how to go about it. So that is one thing. Okay, so again, the definition is basically an acute suppurative inflammation of the lacrimal sac, so characterized by a painful swelling. Okay, so again, it may develop in two ways, right? We have the neighboring structure such as paranasal sinuses, dental abscess in the upper part of the jaw. Factors, as you all know, it's the age, and mostly related to female. Hereditary also plays an important indirect role, and the personal poor hygiene. So these are the factors. Organism which I have already told you, it's Streptococcus, Staphylococcus, Pneumococcus. And again, the stages, this is a important thing, when the question comes in a theory part. So the stage is very important. You need to explain all the three stages, and the signs and the symptoms of the three stages. So first we have is the cellulitis stage, then we have the lacrimal abscess, and then we have the fistula formation. So anyways, in the stage of cellulitis, you'll have a painful swelling which will be red, hot, firm, tenderness, edema, epiphora. You might have fever, malaise. So these are the signs and symptoms of the stage of cellulitis. Then we have the stage of lacrimal abscess. So continued inflammation, this is due to edema. So again, the sac at this stage, it fills with pus, and the anti-wall ruptures. So this is again the lacrimal abscess forms. So it's usually point below and outside of the sac due to the gravitation of pus. So this is again a picture of lacrimal abscess. You all will get a case of acute Decryocystitis most probably. Then we lastly have is the fistula formation. So as I have told you, so when the sac is left untreated, it leads to the fistula formation. So that can be two types again. It can be an internal fistula formation, or it can be an external fistula formation. This is again a picture of the fistula formation, which is external. Okay, so signs and symptoms, which is usually, as you all know, pain, swelling, redness, tearing, fever. Okay, in chronic cases, only tearing can be the symptom. Complications, as you all know, the most common is corneal ulceration, so that you all need to know that. Then we have other complications like acute conjunctivitis, lid abscess, orbital cellulitis, acute ethmoiditis. Then rarely we have cavernous sinus thrombosis, okay, and septicemia. Treatment, as you all know, systemic antibiotics are started, topical antibiotics to control the infection, anti-inflammatory drugs and analgesics to reduce the pain and the fever and etc. Lacrimal abscess, anyways, it when the pus starts at the point, then we need to do the incision and drainage. And finally, the dressing should be done with betadine. And after some time, when this thing subsides, then we think of DCT or DCR. Okay. Hello. Hello. हाँ सुनो बोल। हाँ मैं तेरे को ना 2 मिनट में कॉल करता हूँ। Okay, so in the stage of lacrimal abscess, we do IND, so incision and drainage, and that is usually done in the OT. And after later on, depending upon the condition of the lacrimal sac, either we decide DCT or DCR. So basically, DCR is usually done nowadays. So DCR surgery is basically a procedure that aims to, you need to eliminate the fluid and the mucus retention within the lacrimal sac. And the other motive is to increase the tear drainage for the relief of the EP4. So a DCR procedure involves, basically the removal of the bone, which is usually adjacent to the nasolacrimal sac, and incorporating the lacrimal sac with lateral nasal mucosa. So in order to bypass the nasolacrimal duct obstruction, so this allows tears to drain directly into the nasal cavity from the canaliculum. So this is the main aim of DCR. So mainly, as you all know, the nasolacrimal duct obstruction can result in watery eyes. So this usually occurs due to obstruction of the outflow of tears. Okay. One thing I would like to tell you all, which is not included in this, is the diagnosis. In the diagnosis part, first we come to the history, right? Detailed history is, it is very crucial to, as the cause of tearing and everything you ask to the patient. So the complete patient history should include the assessment of the symptoms, the daily functional status, right? So this is very important, and any medication used, like including the sinus decongestant, because many patients use the sinus decongestants and the nasal sprays. So this is again a very important part. So we need to ask the history. So in the diagnosis, the first thing we need to ask is the history. Then we have is the physical examination. So in the physical examination, we have the visual acuity first, and most important thing, visual acuity, which is best corrected, how the patient till where the patient can read, the best corrected vision in both the eyes. Then we have the assessment of the pupillary function and the ocular motility, right? So we need to check the extraocular movements in all the gazes. Then we have slit lamp examination of the anterior segment. Then another important thing is we need to assess the tear meniscus height. So usually it is 0.2 mm, but this is again an important thing which we usually don't see, but we should see. Then we have the eyelid position. So you need to check the eyelid position, whether the patient is having an ectropion, entropion, or trichiasis, or a retraction. Then we need to check the nasal evaluation also, because the patient sometimes they have allergic rhinitis or deviated septum, etc. So this is again, again we need to check the punctal patency and the position, so which is called the sac syringing, which is usually not done in acute cases. So this you need to remember, in acute cases we do not do sac syringing, it is mainly contraindicated. Then we have the dye disappearance test to demonstrate the delayed clearance of the fluorescein. Then we have the probing and the irrigation of the nasolacrimal system. So these are some things which we need to think, and we need to carry out before making an conclusion and before treating the patient. So in the diagnosis part, I would like to just tell you, because it is not mentioned in this. So in the diagnosis part, we need to take a proper history. We need to do a complete physical examination, which I have told you, and clinical diagnosis of nasolacrimal duct obstruction is basically it's the mainstay. It's made by the patient's history. So this is a very important thing. So the diagnostic procedure mainly involved in Decryocystitis is again it is the dye disappearance test. We have the Jones test 1 and 2. Then we have the probing and the irrigation. So, and again sometimes DCG is done. So that is basically a contrast dye, which is usually injected into the punctum, right, during the simultaneous CT or MRI imaging, to see where is the obstruction actually. So this is again an important procedure which is usually done in these cases, right? But if the case is of pure acute Decryocystitis, so in that case it is usually these are the stages, and the treatment which I have already told you, we usually start off with the systemic antibiotics and topical antibiotics. Okay, you need to remember in DCR the main indications of DCR surgery is usually it is primary acquired nasolacrimal duct obstruction or secondary, right? So this is again a very important thing. The process of DCR, the technique of DCR, I don't think you all should go into the detail of the process of DCR. So you just need to know what is DCR, because the examiner may just ask you what is DCR. He might not go into the detail of DCR. So the DCR surgery, you all just need to know it is a procedure that aims to eliminate the fluid and the mucus retention within the lacrimal sac, and to increase the tear drainage for the relief of the epiphora. So it just involves the removal of the bone adjacent to the nasolacrimal sac, right? So to bypass the nasolacrimal duct obstruction. So this is the only thing which you need to know about DCR, and that's it. So again, I'll just come to this because I had just missed out the diagnosis. So these are the diagnostic part, right? So again, these are the 3 stages which I have told you, and acute Decryocystitis is very important for your practical examination. So I hope it is clear for you all on what content you need to write the answers and how you need to explain things to the examiner. So anyway, today I think I'll stop here, and next I might take a test. Next class I might take a test. I will give you an important questions, so I want you all to write it or note it, and it's basically important questions for your examination. So it will be a long questions, short questions, right? So that part I'll take next week. Okay, so anyways, thank you so much all of you. Take care.